views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Well, I'm Elliot Engel. I'm honored and pleased to serve as a member of Congress in the 16th District in New York. These are obviously very trying times for our country. I'm chairman of the Foreign Affairs Committee, so I'm in the leadership in Congress and have been routinely meeting with our Speaker and our Majority Leader and in trying to push forward things that we think can get the United States back off its feet. And we know that these are very, very difficult times. We're fortunate to live in a nice neighborhood, nice area, but unfortunately, up and down the country, up and down the world has changed as we knew it. So hopefully, we can come up with a vaccine. I held hearings today on the possibility of a vaccine. And we're all in this together. And I think the American people understand that we have to work together to make any kind of progress. And I look forward to talking with our constituents today. Thank you all, those of you who are watching at home or here in person. Thank you for coming out. It's really an honor to represent the 16th District in New York, Bronx, and Westchester.
Good. I had done that. Sorry. Thank you very much, Congressman. Senator Bailey, please, your introductory remarks.
Sure. So good evening, Gary. Good evening, everybody. These are certainly trying times that we're in. Things that we could foresee. We had a crystal ball, but I think Bronx as a state, we are doing the best we can to respond to this scourge of a virus. I've been personally affected. I've had family members who have succumbed, unfortunately, to this ridiculous disease, and it is something that we've never seen the likes of. But that just means that it's time for us to step up. I believe that you can do a couple of things to diversity. You can from it, or you because of. And I think that we are being our the way that we're showing appreciation for those who are doing jobs that many people didn't believe were essential, but now that we know, it's happier now than ever before than when they saw a big 18-wheeler full of food, and you see a grocery worker and a nurse and a doctor and a first responder on the line, putting their lives on the line for us. That's something that I appreciate forever, but it's something that we should appreciate more and more now than ever before. So I just want to say I'm grateful to all of the first responders. We clap for them at 7 o'clock. I mentioned yesterday in North Central Bronx Hospital, maybe the mayor saw me, but I think that we should do a parade here in North Bronx for our first responders and anybody that's out there online. I just want to say thank you. Looking forward to answering a lot of your questions and looking to getting through this together.
I suppose we can begin to the long-term dialogue, maybe one day have a ticker tape parade. I would love for us in New York to be able to handle that. Councilmember Cohen, thank you for joining us and your introductory remarks.
Again, thank you, Gary. Thank you, Jeff, Elliot, Jamal, for doing this all together. I think that this is really a great opportunity for us to to communicate with our constituents. I just want everyone to know that my office is really up and running. My staff is working from home, but they get their email on their phones. When you call my office and you leave a message, it actually becomes like an audio file, and we attach it to an email and we send it to the appropriate staffer. So we're getting phone calls, we're getting emails, people are contacting us on social media as well. And the city council is pretty much up and running. We're going to have a full stated city council meeting tomorrow, which you can live stream. I'm the chair of the Committee on Consumer Affairs. Next week, I have a committee meeting on Tuesday and Wednesday. I think this Friday I have transportation. So I'm really trying to give the taxpayer their money's worth, even through these very, very difficult times. And our office confronted a number of really difficult issues, particularly just helping get food on the table. So it's been very busy, but I'm looking forward to answering all the constituents' questions and continuing to work closely with my colleagues. We did a call, Elliot and I and the entire federal delegation, including Senators Gillibrand and Schumer, and we talked about the city's needs, and that was really productive, I think. It's been busy. So I'm looking forward to tonight, Gary.
Thank you very much. Assemblyman Jeff Dinowitz, thank you very much. Your office has essentially hosted this event, and so we appreciate all the work that you and your staff has done to put this together. But
thank you, Gary. Thank you, colleagues. We are so fortunate. I'm sorry to cut. We are so fortunate to represent the communities that we represent. Just a few minutes ago, we heard, I don't know how many people yelling and screaming and applauding and thanking the people who are actually out there every day doing the work that has to be done. And these are people who've sacrificed so much to do that. We are working, we're not the governor, we're not the mayor, we're not, what's his name? But we have a significant growth. Our office is probably working harder than ever before because every single phone call, messages are left on the voicemail, and every single email we respond to, we try to address questions, provide information to people, help people, and we're getting more incoming than we have ever before. None of us have ever lived through this. None of us have lived through the flu in 1918-19. None of us lived through World War I. I doubt there were too many people even lived through World War II. This is literally the biggest challenge that our country has faced. And we have to get through it, and we will get through it. But we have to be very cognizant of the fact that that this is not going away anytime soon. And I know our community, and I see what's going on or not going on. I'm very proud that people are doing what they're supposed to do, wearing masks, staying indoors as much as possible. And as long as we all work together, I believe we will get through all of this.
All right, thank you. Thank you very much. I will just remind our viewers that if you do submit a question to the Q&A section at the bottom, those will be considered after the pile of questions we had received prior to the event tonight. But we will consider everything and certainly forward questions that are received tonight to the appropriate official if we can't get to them. Let's start off with something that I guess affects everybody in the district, and it has both national and local implications. So we'll start with Congressman Engel, but I'm sure Assemblyman Dinowitz, who has been involved in this, will want to respond to, and that is about the United States Postal Service. On a national level, we're hearing some very difficult reports that Postal Service is well underfunded, and especially during this, like any business, is having very big difficulties. And so what is the future for the post office? And then, of course, on a local level, in this area in particular, and I know for myself, I didn't receive mail for 10 straight days, and there was, especially now, some important mail in there. So let's start with you, Congressman. United States Postal Service, where are we at?
Well, obviously, they're not doing too well. I live in zip code 10463, and we didn't receive mail for days on end. I called the people in the post office in Washington. They have a real problem. It isn't only lack of money. It's the fact that they have employees who didn't show up for work, and they just didn't have enough employees, so they say. That's their answer. They didn't have enough employees to deliver the mail, to do the things that the post office needs to do. I'm not satisfied with that answer, and I told them that it's got to be changed. I think, today we passed the Senate passed. We're going to vote on it on Thursday. More monies for things. I certainly think the post office needs an infusion of cash, so that people who apply for these jobs are people who take it seriously and who intend to function well in these jobs. The problem is, we were told that the people who didn't show up and why people didn't get mail were mostly the younger workers. The old timers showed up. We have to probably pay more. We have to make sure that people get the service they deserve. There is no excuse to not get your mail. I won't tolerate it. Spoke about it in Washington, and ultimately we're going to have to restructure, I think, the post office, get an infusion of money, and do other things. There's been talk in rural areas, perhaps, of turning the post office into a post office bank, and a bank where people who don't have access to banks can do it in the post office. Well, my attitude is if they can't even do the job that they're supposed to do, how are you going to give them extra jobs to do? So I think it all boils down, Gary, to the old money. We're going to need to put more money in there, but there is no excuse for the poor mail service. I won't tolerate it. My constituents shouldn't have to tolerate it. We're entitled. We pay taxes. We do the right thing, and the post office service is a basic service, and we should demand nothing but the best. And I will demand that, and we will get that. There will be wholesale changes in structure in the post office, because not only myself, but some of my colleagues also have experienced this, and we're not going to tolerate it.
Thank you very much. I will add in, Assemblyman Dinowitz, that as far as I understood the explanation, in part, was the low turnout from workers was because they didn't feel there was enough protective equipment. And that, I guess, ties into what the congressman was saying about the budget. But talk about your experiences and interaction with the Postal Service and what's going on.
Well, I think everybody has had some problems with the mail, but 10463 has problems during good times. I mean, let's be honest. There's always been problems with the Kingsbridge Post Office. Really got bad when one of the workers at 6-3 came down with the virus. They had to shut the place down. They had to disinfect the place, but a lot of people wouldn't come in for work. As a result, for weeks on end, we got very little mail. And, for some of us, so what? Let's jump. But for some people, they get medicine in the mail. They're waiting for important checks in the mail. It's really important, and we cannot tolerate bad service. We work together, dealing not only with the post office in Washington, and we stayed on their backs. I think most people will admit that the service has improved markedly. It's not up to what it should be right now, but it's much, much better. We are getting mail now several days a week, but we got to constantly stay on top of it. But there is a long-term problem with the post office, and it has to be addressed even after all of this is over.
Mm-hmm. Funding is one thing. I think every one of us would say that it has to come with a certain promise of efficiency. I don't know, council member or senator, do you want to weigh in on that, or have your colleagues done it well enough?
Sure. It's, 10463 has been mentioned is a problem, I would imagine, but in 10475 in Co-op City, we have the largest naturally recurring retirement community, and many seniors have had issues with the mail in the past. And just not to belabor the point, but just to illustrate the point, how important the mail actually is. Many Gen Xers or whatever generation I'm in, I don't even know what generation I'm in, but we may not use the mail as much as my parents, as much as my next door neighbors, my former next door neighbors, who routinely send my children packages and letters in the mail as a way of communicating with them. So it's something that we should make sure that people continue to get their mail on a consistent basis is vitally important, is crucial, and I think that it's something that I will continue to fight for with my colleagues in government.
All right, thank you very much.
Gary, I'll just pipe in for a second and just say it's a good example of our team working together, because we reached out together to the Postmaster General, and I think that brought additional resources to 10463 to help them sort of dig out all the undelivered mail. So it's always, we're most successful when we work together, and this is a good example of it.
The next question, yes.
And this is going to be even more crucial because the governor is, I don't know if he issued it yet, but he's going to be issuing, or supposed to be issuing, an issue about executive order about being able to vote via the mail and absentee balloting. And we don't know what's going to happen in June. And if we want to make sure our democracy continues to function properly, This is something that we have to ensure we get right. If we cannot make sure people lose faith in the system, people need to be able to have the confidence that their vote will be counted. If it's sent by mail, if it's sent via absentee in the mail, we have to make sure if we do nothing else with the mail, we get it right for June 23rd. We have to make sure that happens.
The next issue is, again, a both national and local issue. And as the congressman mentioned earlier today, the Senate passed a relief bill for businesses. So we're going to start there, and maybe Congressman explain what was done today by the Senate. And you said you'll vote on it either tomorrow or later this week. And then I want to talk about locally, all the way around the table, for small businesses and how they're doing and what we're going to do to build up our small businesses in this crisis. So, Congressman, what happened today in Washington, and what are the implications?
Well, the bill we passed today essentially gives lots of money, billions and billions of money, to three compartments. One, of course, is small business, and small business, of course, is the core of keeping our country alive and what people do day in and day out. Think of everything you do, from buying food to buying clothes to buying whatever, and we cannot afford to let these businesses go under. So the Paycheck Protection Act is $310 billion for that, which is part of the $370 billion to small business. They also today voted for $75 billion for hospitals. Hospitals are in poor condition all across the country. We are lucky in New York to have top quality hospitals, but even there, during this terrible time, the hospitals have been stretched very, very thin. And then there's $25 billion for testing. You know, Nancy Pelosi, I think I said it before, loves to say testing, 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 because in order for us to really be able to see what's going on, we need constant testing. You can't just test one time. That gives you a snapshot for that day, but it doesn't show the direction that things are going into. In other words, think whether things are getting worse or whether things are getting better. You can only do that with multiple testing. And so that was put into this bill. There will be another component of the bill. You know, we've passed two of them, the CARES Act, healthcare, this one, and then there'll be another one after this, which is supposed to be number 4. This they're calling 3.5 because we just needed to put some stuff in. But only the federal government can do it. You know, when we were going to school, we were learning about the Great Depression of the 1920s and early 1930s. We've never lived through anything like that. This has the potential to be as bad as that or worse. That's why we're going heavily into debt. But this is something that only the federal government can do. And I support it wholeheartedly. And we're going to come back again and go through a bunch of other things. For instance, we have a situation which we call SALT, which is state and local taxes. People who own private homes cannot deduct, in New York, cannot deduct the money that they pay. That was something that the president put in, which was a punitive measure. Chuck Schumer and I and others in the delegation are fighting to get rid of it. It hurts middle class people. It makes property values go down. And my objection to what the president has done is he's given tax breaks to all his rich friends and let the middle class and poor people sort of struggle. I will say in conclusion that we took these bills, which initially were presented to us by the Republican Senate, and they were actually bills for Wall Street. They were bills to enhance people making millions of dollars on Wall Street. We wouldn't support anything like that, so we had it changed.
I've been talking for a number of days, as have most governors, about testing as the next phase that we have to enter into. We're starting to talk about reopening and planning reopening. Everyone is obviously concerned about how you reopen, and if you reopen in a way that is too rushed, and you're not prepared, you could actually see the infection rate go up, which is the last thing that anybody wants. And testing is the best way to inform and educate yourself as you're going through the reopening process. So you can watch not just hospitalizations, which will have that data, but also testing, so you can look at the infection rate across the state and see how the infection rate is increasing. Also testing for employees who want to go back, employers who want to know whether or not the employees are actually negative of the virus. So testing has been a very big task to undertake. There's also been a lot of back and forth between the states, my state included, and the federal government about who does what on testing and who's responsible. I said this morning that I think in many ways people were just talking past each other because the federal government is helping on testing and states are responsible for testing. But testing is a very complicated issue with a lot of levels. So to have real progress, you have to sit down and go through the various steps of testing and actually decide who does what. And that's what we did this afternoon. We agreed that the state government should be responsible for managing the actual tests in their own laboratories. We have about 300 laboratories in the state of New York. We regulate those laboratories. It's up to a state to determine how many tests, where those tests should be done, New York City versus Buffalo versus Long Island, et cetera. The staff to do those tests, how often you do the tests, those should all be state decisions and state responsibilities. The antibody test, which is one of the tests, how do you use those? When? That should all be up to the states. The tracing function, that is the function after testing, that actually traces people who are positive, who did they come in contact with, to isolate them, that's all the state's responsibility. The problem with testing and bringing testing up to scale has been the national manufacturers of the equipment who make the testing kits that they have to send to the state labs so the state labs can actually perform them. Those are done by national manufacturers. And the national manufacturers have said they have a problem with the supply chain to quickly ramp up those tests. They need swabs, they need vials, and they need chemicals, quote unquote, reagents. That is where the federal government can help. States cannot do international supply chains. I guess they could, but not in this time frame, and that's not what we do. And you shouldn't have 50 states competing to do international supply chains. One of my colleagues, Governor Hogan, the chairman of the National Governors Association, who is the governor of Maryland, Republican, good man, he was bringing tests in from South Korea, very creative and proactive on his part, but that's not what states normally do. So let the federal government take responsibility for that federal supply chain for the national manufacturers. And that's what we agreed in this meeting. That is an intelligent division of labor, in my opinion. Let each level of government do what it does best, and it ends this back and forth. What do the states do? What does Washington do? Who's responsible, et cetera. To quantify that situation in the state of New York, we now do on average of about 20,000 tests per day. Our goal, which is very aggressive and ambitious, but set it high and then try, our goal is to double the 20,000 to get to 40,000 tests per day. We'd need several weeks to ramp up to that, but it is a very aggressive goal. That is our current system at maximum. That's our current laboratory system, 7 days a week, 24 hours a day. The maximum our system as it exists can do is that number. So that's our goal, and it was a very productive conversation. And again, that is the biggest single task we have to do that is identifiable from today. And it ends the whole back and forth and the finger pointing in a very fair and smart way. It's a smart resolution. So I feel very good about that. And if we could double our tests, that would be a home run. I mean, that is a really, really big deal. We also talked about funding to the states. The legislation that the Congress passed did not have funding for the states. It passed additional money for small business, and that's great, and we need that, and that's a positive. But it did not fund state governments, which to me is just a mistake, frankly. Fund small businesses, fund airlines, but you don't fund police, you don't fund fire, you don't fund healthcare workers, you don't fund teachers, you don't fund schools, you cut the aid to schools in this state. You know the state governments are broke, to use a very blunt term, and you know the state governments are now responsible for the reopening, and the governors are going to do the reopening, and they have no funds to do it. So we talked about that. The president said he understood the issue and that he would work very hard to get funding for the states in the next piece of legislation that passes, and we hope there is another piece of legislation. I also told the president from a parochial point of view, we had a conversation with Secretary Mnuchin and the president, that there is a match, what's called a local match for FEMA funding. When the FEMA does something, the local government should match that funding by 25%. I said to the president, there is no way New York can pay that match because we don't have the funding, period. And it is disproportionate to New York because we've had such a much larger number of cases than any other state in the United States that it falls disproportionately on New York, which disproportionately is dealing with this crisis in the first place. We get all the hardship, and then we get a bill because we had the hardship. Makes absolutely no sense. And as a practical matter, we couldn't pay it anyway. The president said he understood and that he would work to waive the local match. Secretary Mnuchin said he understood. Secretary Mnuchin was very supportive. And I thank him for his support. And the president said that he understood and that he would take care of it. And I believe that he will because he did understand it. And that's a big deal for the state of New York. Again, the incongruity. The state that had the most pain and death should get a bill because they endured pain and death. I mean, it makes no sense. So that was a lot, and it was complicated, but vitally important. And the resolution was good across the board. We met not just with the president, but with members of his team, because a lot of this is granular and detailed, and if you don't work out the details, there is no conceptual agreement, right? It has to be on the details so people actually know what we're agreeing to, and it was on that level. So I thank all the people on the president's team who made themselves available and worked this through with us in detail, and it's a really positive resolution. Any questions?
So, Governor, did you get any commitment on either testing or aid, or no?
Yes.
What was that?
Commitment is to attempt and make all efforts to double the number of tests that the state is taking from 20,000 to 40,000. The federal government will work on the supply of tests and reagents from the national manufacturers. They'll take that half of the equation. We will take the half of the equation that is working with the labs in the state and getting them to perform the tests, but we need the test kits from the manufacturers. National manufacturers need the supply chain. That's what the federal government will be doing. We'll be working with the labs to actually get the test takers, go out, take the test, and run those tests in the labs.
And how soon can we expect those tests to come to New York, and how much will that cost?
It will take several weeks at best. This is an enormous undertaking to go from 20 to 40. Remember, it has taken us over 1 month to get to where we are today, which is on the average of 20,000 tests per day, which is the highest single amount in the United States of America of any state, which is a higher per capita testing rate than any country on the globe, right? So we take 20 per day, which is already an enormously high number, and now we want to double that number. So it's just, in some ways, an outrageous goal, but this is New York, and we're accustomed to outrageous goals. So it's 40. Federal government will take their piece, which is the supply chain for the national manufacturers, reagents, testing kits. We'll take the 300 labs and coordinating that. Again, it took us 1 month to get to the 20,000, which is an extraordinarily high number. Think about it, 20,000 tests per day. That's a system that never existed before. There was no such thing as a COVID test operation before today, before this situation. The price tag, it will be expensive. We don't have a price tag. We're working on estimates. And remember, after the testing, then you move to tracing, which is a whole different operation of people who trace every positive case. So if you have 20,000 tests per day, let's say the positive is 30%, just for kicks. That's 6,000 people per day who test positive, and you then have to trace every one of those people to find out who they were in contact with, who did they go to dinner with, who did they in direct contact with that they might have infected. That operation is going to be enormous.
Considering that the state has already done so many diagnostic tests, seem to kind of be doing 20,000 a year, why the emphasis on that and not on antibody tests?
Both.
Both
tests. We have to do both, antibody tests and diagnostic testing.
Both of those will get up to 40,000 a day?
Yes.
By when?
We don't know. It's never been done before. So we said, we're working 7 days a week, 24 hours a day. But you have to assume a few weeks to ramp it up. We got to 20,000 over 5 weeks.
But just of the diagnostic, not necessarily.
Just of the diagnostic. Now you want to double that. We need a supply chain for the national manufacturers, which the federal government has to work on, which is an international supply chain to get these chemicals, et cetera. And then we have to get the labs to double their capacity. And to have test takers out there to supply the labs with 40,000 tests per day. I mean, it's an enormous undertaking.
But just to be absolutely certain, you got a commitment from President Trump to try to get to 40,000 antibody tests per day in the state of New York.
40,000 diagnostic and antibody.
Combined?
Total. Yes.
And did the president shed any light on how exactly he'll do that? If it's a matter of the Defense Production Act, if it's a matter of working, overseas?
We did not work through, we didn't talk through how he's going to do his end of the operation, but we didn't talk about how I was going to do my end of the operation either. Remember the antibody tests. The question is, what is the purpose of the antibody tests, right? And it's
Fight. We can't get the country industry mobilized. The president can't get the major corporations mobilized to deal with this, to deal with testing, and that's just one of the things that has to be done. So it's all about leadership, it seems to me. With the right leadership, this would be done. But unfortunately, I believe many people have died because of the lack of leadership. We can't undo that, but we at least have to make sure going forward, that we keep people safe and protect people.
Congressman, you can have the final word on this particular one.
Well, let me say, I helped secure, in my role as chairman of the Foreign Affairs Committee, 1,000 antibody tests from China. It's galling, I guess, to have to go to China. I called up I spoke with the Chinese ambassador to Washington, with a member of the city council. I know that Andy Cohen supported it. And these are the types of things that we have to keep doing, because testing is just so important. We can't move ahead unless we test. The whole problem with the virus, if we don't test, we just really don't know. And I think that when I see people in some states, governors in some states, changing the law and allowing people to recongregate and get together again, it's foolhardy, and it's going to make those areas of the country go sky high in terms of people who ultimately get the virus. It's terrible. The other thing that I wanted to mention was that the president the other day issued an executive order which would ban any kind of immigration, put a hold on it, people coming into this country because of the virus. The fact of the matter is, unfortunately, we have had more people die in the United States, more people get infected who live in the United States than any other country. So who are we preventing from coming in? What barriers are we putting up? It's just hypocrisy. We're all in this together. We're all human beings. We need to help each other. The vaccine could be as far as 2 years away. We had hearings today, which I chaired, and the vaccine is most likely 2 years away. That's a long, long time. We have to work together with all countries around the world, and not to be narrow-minded. And again, testing.
There are there is considerable concern about the upcoming elections. Number one, we're looking at a primary on June 23rd. That's a pretty significant primary. We have many races that are being contested in the Bronx. And of course, you'd be asking people to congregate, which is probably not what we really want to do, even as late as June 23rd. And also, as established in this dialogue, a lot of concern about the post office. So if you're starting to mail ballots, so let's start with you, Assemblyman Dinowitz. What needs to be revised in order so that we have a fair and smooth election throughout the Bronx, the city, and of course, the state of New York?
Well, it's going to be difficult any way you slice it. Right now, today, the ability to apply for an absentee ballot has been greatly increased because people no longer have to be sick. They could say they're worried about the virus and they can apply for an absentee ballot. It's our understanding that the governor might be issuing a mandate that the Board of Elections automatically send out an absentee ballot to every single eligible voter. Which could be a great thing. That's voting by mail. But I am concerned about the mail, get the people getting the ballots and the ballots getting back to the Board of Elections. It's not clear whether polling sites will be open or not. It's also not clear whether the presidential primary, which was postponed from April 28th to June 23rd, will still be on the ballot because all the candidates dropped out except for one. I'm not sure I see the need to have for that, but one of the candidates who dropped out has some supporters who still think he should be on the ballot, and of course that'll just add further confusion to the whole situation. But I think the bottom line is people should have the ability to vote, whether it's by mail, whether they want to go to the polls, but I do believe most people are not going to want to go to the polls even in late June. So if the governor issues that executive order, we have to make sure it works.
Thank you very much. Senator, let's go to you, and then we'll go to the council and the United States Congress. It's funny because a lot of times these issues, I say, well, this is very obviously a state issue or a city issue, but all of these obviously cross all levels of government. So, Senator, what do you got?
Sure. I mentioned a lot of what Assemblyman Dinowitz already mentioned, so I won't belabor the point, but we just have to make sure we have the sufficient guardrails. Ultimately, this could be a boon for turnout, right? We always want people to participate at major levels in every election. And Washington State, which I believe is a vote by mail state, their participation rates are significantly higher than New York State's. So figuring out a solid vote by mail situation could be really great down the line. But again, we haven't worked that out. We haven't held the requisite hearings. Our great chair of the Elections Committee in the State Senate, Zelnor Myrie, has yet to be able to explore that one. We just got early voting this coming year, so that's also something we have to consider. We've got early voting. Are we going to do early voting by mail? How are those things going to be counted? So we have a lot of work that we can get done at the state legislature, and I'm looking forward to rolling up my sleeves and getting it done. So
sounds like the answer to this is more to come. Councilman, do you agree with that, or do you have thoughts on that?
I don't usually opine on my colleagues' offices, but I'll tell you one thing. They should have 4-year terms. having to run every 2 years, these elections are complicated. Getting people to participate is really, it's not what it should be. And having to run elections every 2 years, I think it doesn't necessarily serve the public as well. It'd be nice if they had 4-year terms like me.
There you go. Thank you very much. Congressman, your thoughts? You are running for office. I guess the others are too as well. But you want to talk about the primaries and where we're at?
Sure. Well, it's June 23rd. It's my daughter's birthday, so what could be better than that? And she told me she's voting for me. Anyway, look, ultimately, I think this year there will have to be voting, not the usual way of voting. I think that there are a lot of people who are not going to want to come out. There are a lot of people who don't want to get close to anybody because of all the things that we've been warned about. And so I think it does have its problems, but I think it's the best way to ensure that the maximum number of people that can vote. I mean, we want to see people vote. We don't want to see where 90% of the people don't vote because they're afraid to go out. That would surely not sit right with our democracy. New York was moving in that direction anyway. The legislature changed archaic laws, which made it impossible for certain people to vote. And now that we have this pandemic, it's going to be pushed even more in that direction. And I think it's probably a good thing ultimately. And I want to tell Andy King that if he could arrange a 4-year term for me, I'd take it. Thank you.
One thing I neglected to mention when we were talking about testing, and the Assemblyman mentioned it, and we did get a question about the antibody testing. I was aware, and I was only aware through word of mouth, through like email lists that I'm on, about testing that went on near Stop and Shop and then over at BJ's Wholesale on Broadway today. But I never saw any general announcement of it. I don't know, Assemblyman, I guess it's coming out of the state. Any thoughts on how people can find out? Because I think the enthusiasm for it was, yeah, we want to participate. We want to do what we can.
Well, I think the antibody testing is not necessarily for the general public. It's not advertised because it's supposed to be random testing. It's sort of a data gathering mechanism, as I understand it. And so I guess they did not want a certain group of people to do it. I mean, I would love to get the antibody testing myself. Who wouldn't? They just stick a little thing in your finger. But I think it's supposed to be random because they want to, at least initially, get a general idea of how widespread the antibodies are in the general population.
Gary?
Yeah, sure.
Pipe in for 1 second. Sure. Congressman Ingle mentioned his work with my colleague Steve Levin with a Chinese company that had antibody tests. He said he was able to procure 1,000 tests, but it was actually 100,000 tests. So that's very helpful. I think that goes a long way. So I want to say thank you, Elliot.
Great.
Thank you.
Councilman, let's stay with you. There was a question that came in asking about the number of cases in your district. And I'd like to extend the question, and tracking of this thing is, of course, as important as anything else. So I don't know if for you or anybody wants to talk about, number one, what is your area look like? I think that would be very important for your constituents. And then in general, how accurate are we with some of this tracking? Do you trust it? I mean, because there are reports now that people may have died and either they died from the virus and were not being reported as such, and other people who died maybe from cardiac arrest, all of a sudden they said, well, it happened now. He probably died of the virus, that kind of thing. There's not a lot of accuracy. So what are your thoughts?
Well, I have the information by zip code, which doesn't perfectly mirror my district. But the latest data I have is over 15,000, almost 16,000 reported cases. But I don't think that's only people who've tested positive. There are many people, my own colleagues I know, who, in all likelihood, had it, but never got tested, had fever for a few days, were sick and got better. So that case is undocumented. And then for people in the 50th precinct, I had a conversation with the commanding officer a little while ago, and he talked about the number of dead on arrival calls that they have been running, where they get to apartments and they find people who have passed away. Initially, the medical examiner was not doing autopsies, was not determining the cause of death. So we'll never know, I think, the number of people until widespread antibody testing is available. We won't know how many people have had it. But the results have been tragic.
Senator, let's talk a little bit about enforcing the rules. And I know it's the mayor has talked about exactly what would be actually enforced when it comes to social distancing. Now the governor has stepped it up, requiring people to wear masks. You chair the, I forget what the formal name of the Criminal Justice Committee, that committee. And so talk about how far the state could go or should go in enforcing rules of people who should be wearing masks and, if they're going shopping or something like that, as well as if they see people in a park gathering, should a police officer issue a summons, at what point? Let's talk a little bit about enforcing those rules.
So it's the Committee on Codes, and it's one of these situations where we want everybody to be as safe as possible. We don't want to over criminalize individuals, right? So what you don't want to do is create a criminal record for somebody for not wearing a mask, right? It's very important to wear a mask or a face covering. Let me be very clear. I want to be crystal clear about that. But what if you don't have a mask? What if you're not able to find a face covering? What if you're in a neighborhood where you're an essential worker and you have to continue to go to work day after day, and you run out of a mask, and you run out of face coverings, and you run out of these things? We have to be mindful of those things. The governor he said a quote in the New York Times, and I want to paraphrase him because I can't remember it exactly. And they're talking about monetary fines, which again, to me, aren't great, but they're better than creating an arrest record for individuals who are continuously who are doing this. Also, it should be noted that, again, I mentioned continuously. Are you continuously doing this? Is this something that is persistent and ongoing? That should also be taken into consideration. Bottom line is that people need to listen. They need to stay home. They need to go out only when necessary. But I'm uninterested in creating creating new criminalization because individuals are not wearing masks. And
All right. Thank you very much. Assemblyman, let's talk, and maybe the council member also has a point of view. It is, of course, a national issue. The question of nursing homes. It's a very difficult situation that senior citizens, we could also talk certainly about people who are incarcerated, but senior citizens in a nursing home, they are only as protected as the staff of the nursing home is. And those people are working around the clock in very difficult circumstances, and the numbers are going through the roof. So please, Assemblyman, weigh in on that. What are your concerns?
Well, I think the people who reside in nursing homes are sitting ducks. There are a lot of people, they're very elderly, and many of them have underlying conditions. It's sort of a perfect storm for people getting sick and dying. And we know from the list that came out last week that was paid that two of the nursing homes in my district are on the list as having a significant number of deaths in the nursing home recently. And I suspect the numbers are much greater. We talked recently about there being massive testing done in NYCHA developments, for example, which I think is very important. A lot of people living very close together. I believe the same thing should be done in nursing homes, and it's not routinely being done. Many people can't get tested in a nursing home where you have the most vulnerable people. We have nursing homes. There was one in, I don't know if it was in Jersey or someplace, where 70 people died. That is crazy. And that in and of itself is a national emergency. So I think we need to, number one, be able to get the information, which means having the testing, and then proper action has to be taken. These are literally our most vulnerable members of society, and we have to do something about it. My district happens to have a significant number of nursing homes, and I think a lot of people have already died, and it's just horrible.
How do you address, how does that get addressed? I mean, do you look at the nursing home itself? Is there, a PPE issue? I mean, let's try to unravel it a little bit, I guess.
I'm sorry, you're talking.
I think
there's a multiple number of issues. I think PPE is part of it. I've heard complaints. We've seen it on TV. There isn't enough PPE in many of the nursing homes. You don't have the testing. people are, I mean, many people live two to a room. I know that if they have the virus, they're presumably isolated, but it's in there. People are coming from outside into the home. So even if nobody has it, all it takes is one person to bring it in there. And this virus is spread so easily that it can go to everybody. The difference between a nursing home and general society is you have people who are in their 80s, who are in their 90s, who are the most likely potential victims in terms of dying. And I hope that the government has been awakened. I think that the governor is on top of it, but there's almost a callous disregard for people around the country in nursing homes, despite all the stories. And a lot of people live in nursing homes. And given the numbers, it is the highest per capita rate of people dying from COVID-19 of all segments of the population.
Assemblyman, thank you. I want to talk about budgets, and so that's going to involve everybody in the room. We'll start, I guess, because it starts at the federal level. So we'll start with Congressman Engel. In none of the stimulus packages that I've seen, and I've heard that Mayor de Blasio talked about airlines getting $52 billion, while the city of New York got $1.4 billion, and then the mayor taking a look at the city's budget and thinking, "Gee, next time around we are going to have." I forgot what the number was. Something like at the moment an $11 billion shortfall, and yet there has been no effort, it appears, from some of the Washington stimulus monies to go toward states for these kinds of things. So let's start there, Congressman. What are your thoughts about budgetary issues that ultimately will, excuse the word, trickle down to the state and then the city?
Well, we, of course, the bill that's being voted on this week, we call it the 3.5 because it's between bill number 3 and bill number 4. Bill number 4, which we will vote on next, and we'll put our heads together and hopefully come up with a good bill, will contain a lot of support for state and local governments. New York City, New York State has lost a lot of revenues because of this, and are going to need lots of money to make themselves whole. That is absolutely going to be negotiated in the next budget, and I believe New York will do very well because we are a delegation that has a lot of seniority, and we will push to make sure that New York gets its fair share and then some. So that will happen in the next, not in the one we're voting this week, but in the next one that comes, and that'll be the last of all the bills.
Let's talk to our state officials. Gentlemen, you guys had to pass a budget, and I think a quote that I saw from the governor was, "Oh, sure, we did great. We have no money." So how do you even begin to look at a budget when certainly the state is not collecting taxes? When it does eventually collect taxes, the numbers are going to be minuscule, certainly compared to what they've been. So, Senator, why don't we start with you, and then we'll go to the Assemblyman, and then we'll look at the City Council budget.
Sure. Revenue. Let's figure out a way to get those who can pay more to pay more. I mentioned it earlier, and it bears worth repeating. We have to figure out a way to make sure those who are well off that can pay more. Taxation is sometimes an evil and ugly word, but it's something that you have to look at it. And I usually don't make these apples to oranges comparisons, but Ruth's Chris Steakhouse, whose food is great and everything, but if they're getting $10 million, but local small businesses aren't, there's a problem with the way that things are working, right? There's a problem with the functionality of what's happening from the federal government on down, right? So, one, it's more revenue, and figuring out a way to be able to get more revenues to the hands of people who need it. Because Johnson Avenue up by you, and White Plains Road, and Boston Road, and Gramercy Avenue, these places, we cannot afford to let them become ghost towns. We simply can't go to big box nation, right? We have to be able to get our small businesses and the men and women who work and live, not just work, and live in our communities as well. So we got to make sure that we do everything that we can to support them. Very tough budget. It was a very difficult vote for many of us on many issues. Education funding was flat, and I think that was a person's effort to be able to keep that flat. But our kids need education, our kids need funding, and we have to be able to figure it out more. So let's figure out a way to raise revenue.
Assemblyman, you are close to the MTA budget and the MTA functioning, and they, of course, are hurting real bad right now. That goes into the, we talk about a lot of different services, but that's a vital service. And then, of course, are people going to want to go on the subways and buses after we go through this? So I'm throwing the MTA into the whole budget question.
We have a huge problem that's not going away anytime soon. And I hope, and I know that the problem we have is we have that president and the leader of the Senate. So it's almost like 2 against 1. But the fact is, the states, MTA, hospitals, there should be more money for that, not for bailing out some of the big corporations. I thought I heard something out of his mouth the other day, maybe I misheard, that he was worried about the oil companies. You know what? I don't care if they're getting negative dollars for their oil right now. They should never get a penny of bailout from the taxpayers of the United States. On the state level, our biggest sources of revenue are from the tourism industry, from Wall Street, from real estate. And all 3 of those industries are reeling right now. We are not going to have the money that our budget provided for. The governor was given their powers to cut the budget during the course of the year, and I'm sure he's going to use it if he has to. But I think Senator Bailey is absolutely correct. It's almost malpractice not to consider raising taxes on the wealthiest of people. We have a whole bunch of billionaires who could afford to pay more. We have a whole lot of millionaires who could afford to pay more. We have to raise billions of dollars in revenue just to still be behind where we were a month ago. And if we don't take those kind of actions, then I think we are going to roll into a great economic depression in the state.
Assemblyman, just to follow up on the addendum that I threw in there, what are your thoughts about the MTA and where they're at now, and how the MTA will survive after we kind of, lift some of the regulations?
The MTA had long-term problems before the virus. They have huge capital obligations that must be met if we want our subways and our buses to be able to continue to operate. Nobody is going to get on a train if they don't have to for the foreseeable future. The people who are on the trains and the buses are people who have no choice. They have to get to work. But most people, we try to encourage people to take mass transit, not to drive. People are going to drive. They're not getting on the subway for the next several months at best. And that's going to mean a huge loss of revenue to the MTA. So as bad off as they were a few months ago, they are much worse off. And if we don't get help from the federal government, and the fact is New York City is the economic driver of the country, and it is in everybody's interest for New York City to be able to run and New York State to be able to run.
Mm-hmm. Councilman, I didn't track the number that the mayor said, but he said as we come to budget time, we're looking at a, I think it was like a $11 billion shortfall, but don't quote me on that. But this is a very serious time for the New York City budget, isn't it?
Well, the city is obligated to have a balanced and on-time budget at the end of June. And the mayor had introduced his preliminary budget, and we were projecting to spend about $95 billion. By the time April rolled around and he released his executive budget, he had slashed that to $89 billion. We received, I think, about $800 million less from the state than we were expecting. Revenue is way down. It is going to be a very, very challenging budget. I will say, and I know this is not on message because we do need the federal government to step up and help us, but the city, I think, has actually been very prudent in establishing reserves. We have prepaid a lot of expenses. The voters actually allowed the city for the first time to have a rainy day fund. But even before that, the city had used this prepayment device to kind of roll revenue forward. So that we have a significant reserve, but it is raining outside, so the rainy day fund is going to definitely be drawn down.
Councilman, let's stay with you. I'm going to ask a specific question that was submitted, and then we can look at it in a more general way. someone asked very specifically about the new playground next to PS 24 and the construction work, and where that is at. But I'd like to extend it, and I know there have been a number of questions asked to the mayor about construction work in general and what is appropriate and what is not appropriate right now. And for example, I went by Van Cortlandt Park on Broadway, and we're still working on the skate park there, which is kind of a nice thought. What are your thoughts, number one, about PS24, and number two, about construction in general?
Well, the good news about PS24, and I know this is probably not the venue to really talk about this, but upgrading our parks has been a passion of mine. The work at PS24 is to upgrade the water element there, and anybody who's gone there, I took my daughter there when she was young, and it was a stick in the ground with a spray head, and so it's just about done. It's 99% complete, and I think it looks beautiful. I'm really looking forward to when this is over to a ribbon cutting there. I'm doing the same thing in Woodlawn, at Kossuth Playground, in Norwood. Really just, it's been a passion of mine to upgrade these playgrounds. So that work, when the order is lifted, the Spuyten Playground will be ready to go. Construction has definitely been a challenge for people who had projects in the middle. Honestly, I have a neighbor who recently bought the house nearby me and has not been able to complete the work, and I know it's a hardship on them that they can't move in. So there are challenges, but keeping the public safe is obviously what's driving all the policy.
Thank you very much. We'll start with the federal government here and go to the state. Co-ops have been left out of federal loan programs. And I know for myself and many people who do live in co-ops are saying, well, wait a minute, we need it as much as anybody else. So what can be done? Is that part of one of the 3.5 or the level 4 funding? Where are we at as far as giving some of this, the relief that's going out there to co-ops and condos?
Well, I live in a co-op too, and so I guess that makes me a cooperator as well. And I've always liked co-ops. Co-ops are unique to New York City, but co-ops are actually the same as if you moved into any kind of building. So people who live in co-ops should not be penalized, and the government should treat co-ops like any other housing. Anything that's available for anybody else should also be available for co-ops. I'm going to keep fighting, rolling up my sleeves, and fighting until we get that.
Is that on the table? Can that be put on the table? I'm just asking.
Yes. It can be, and it will be, and it should be.
Okay. Anybody else want to weigh in on the co-op issue? I guess not. Okay. Let's talk about education, and we've touched on education funding. There was one question asked, what about canceling the CUNY tuition and fee increase for the next year? So either one of our state officials can address that. Senator, we'll start with you.
I believe so. I think our public institutions. I'm a public school kid, K through JD, SUNY Albany and CUNY Law School. So I owe a lot of who I am to public education. And I think in times like this, and even before the COVID-19 hit, we were discussing how do we stop balancing, budgets on the backs of those who can least afford it, right? And those who seek public education should be allowed to seek it without having to have these onerous cost increase. So at the present time, I definitely think that there's a freeze in order. I don't think that we should for a second think that we should allow people to think about paying more money for education, especially because of so many challenges with distance learning at the higher ed level and at the elementary level education, right? Like there's so many different challenges. So I think that we should keep CUNY and SUNY stuff, the tuition frozen, to keep the fees frozen, and figure out, again, a better way to raise more revenue so that we can fund our public institutions.
Of course, that goes to the previous question about budgets, but Assemblyman, you're a Lehman graduate. Talk a little bit about what you think about the CUNY tuition. And I think when you and I went to a Lehman college, I think we paid maybe $75 for
Excuse me, I paid $87.
Oh, well, it was an activities fee. So anyway, go ahead, Assemblyman.
To me, it's a failure of our society that we cannot do what we did when I went to college. We didn't pay tuition. Somehow, the city and the state afforded us to be able to go to the city university for free. And if we could have done it then, and by the way, that was during, there was some tough fiscal times when I went to school, we could do it now. Now, it's true that the majority of kids and adults, I guess, the majority of students who go to CUNY are not paying. They're getting they're getting TAP and other things, but a lot of the people who go there are paying. And we cannot deny people an education. People who get a college degree, they get a better job. They pay more taxes to us. It's in everybody's interest. And it just was never clear why we're not providing a free tuition at City University, but it's clear why that happened. I know when I first got elected, year after year after year, and this was after free tuition was gone, we kept lowering taxes. When I say we, I mean generally it was the Republican governor at the time. We forfeited hundreds of billions of dollars in revenue from the state as a result of those tax cuts during the 90s. And if we had some of that revenue, we might not be in such a pickle today that we are. And I think it would be abominable if we raised tuition for students at CUNY, at any of the colleges at CUNY.
I want to ask this and have each of you kind of weigh in, because it's not targeted, it's targeted, I guess, in general. This came in on one of the Q&A questions that somebody submitted along the way this evening. And it's really something I think that is very obvious. The borough of the Bronx has had epidemics in, and this is prior to the current pandemic, in asthma, in diabetes, in obesity, and in drug use. And the numbers, even though originally, I think when they started to put them out, the Bronx looked okay. But now, of course, our rates of deaths are higher than anybody. Our rate of positive tests are higher than any of the other boroughs. So what in general, because we hope we will learn something out of this, in the long run, and say that what changes can we make, I guess, both personally and also legislatively, to ensure that all of us in the Bronx do better health-wise, and so we're no longer number 62 in the state. So I don't know who wants to. Everybody, I'm sure, has something to say about it. Let's start at the council, and then after that, we'll go to the state and then to the Congress. So, Councilmember Cohen, your thoughts, healthcare in general, and what would you like to see once we get out of this so that we do better?
Well, I don't think it's exactly a healthcare issue. It's a poverty issue. I mean, the Bronx, all of these comorbidities travel with poverty, and that's really the truth. The diabetes, the high blood pressure, obesity, they're all indicia of poverty. And at the council level, the tremendous investment in affordable housing, UPK, 3K, these are all programs designed ultimately to try to lift people out of poverty, particularly Bronxites. That's the kind of really Marshall Plan kind of investments that the Bronx needs. And if we could get people out of poverty, get people, the quality education that they deserve and need, those are the kinds of things that are going to ultimately translate to, longer life expectancies and better quality of health.
Assemblyman, your thoughts?
I think people are learning now something which we in the Bronx knew for a very long time. The Bronx has the highest asthma rates, the highest diabetes rates, the highest rates on a lot of other bad things. And those rates are particularly concentrated in certain parts of the Bronx, among certain communities, among African American and Latino communities in particular. And if we don't do something to deal with that incredible disparity, we have to look at the racial, the ethnic, and yes, the gender differences in the population in terms of who's catching this, who's dying from it. And the answers are becoming pretty clear now. And we have a long-term issue to deal with. And that's why I support the New York Health Act, for example, because I want to make sure that everybody has access to good health care and no one is denied health care because of their income, because of the type of job they have. And while we should have been doing something about this a long time ago, this is a huge wake-up call. And if we don't listen to that, then shame on us.
Senator, the Assemblyman mentioned the New York Health Act. What are your thoughts about this being a fulcrum to kind of move things forward in the state Senate on that regard? And then you can weigh in on the question of health in general, too.
Sure. I am a co-sponsor of the New York Health Act. I've been a co-sponsor since my entry into the legislature. So it's something that I firmly believe that we should be looking into. We have to consider costs and other variables, but it's something at a basic level, we need to figure it out. Look, we've known long ago, if you read The Power Broker, and you know what Robert Moses did when he divided the Bronx. And when he divided Bronx, he divided the Bronx into what people thought, or what I believe was a caste system, right? Those who had it and those who don't. In areas that I represent, some of us don't have it, and we haven't had it for a long time. And the reasons why we don't have it is because we don't have the access to it. We have the diabetes, the hypertension, the asthma. We have all of those things, but we don't have, or we haven't had, is proper access to healthcare, proper access to economic justice, economic democracy, and reimagining on how we're doing things from an economic scale. This crisis should teach us who's really essential in our society. People that we once looked upon, not me as in me personally, but society looked upon as disposable. Those are the folks that we need day in and day out. These are the folks in my communities that I represent that have these comorbidities, that are suffering, that are dying every single day in their homes. We got to figure something out. I think we're going to figure something out because we don't have a choice but to reimagine it. So I'm tired of being number 62 in every healthcare outcome in the state of New York, the Robert Wood Johnson Foundation. I'm sick and tired of that. I think we can do better for my daughters and for yours. We've got to do better, and we will.
Thank you very much. Congressman Engel, healthcare, you probably spent more time on that than just about anything, but now certainly push has come to shove. What do you foresee in terms of changes as a result of this international pandemic?
Well, I'm also on the healthcare committee as well. Healthcare is not a luxury; it's a right, and it should be a right. And I won't be satisfied until every American has access to quality healthcare. In the Bronx, we, as my colleagues have said rightly, we have known about this for a long, long time. A lot of it involves education. A lot of people have come from backgrounds where they ate unhealthy, and so they just carry it on to when they become adults. And a lot of it is really educating people. I mean, that's why right now, when we had to close the schools because of the virus, a lot of children get their lunches, get the best food that they eat from the school, in school. And that's why these programs need to be given federal dollars and state and local dollars as well. But it really starts at the beginning. If you are used to eating the wrong thing and making bad choices and don't know any better, that's how you'll grow up, and that's how your kids will grow up. So we need to break that cycle. And in America, we've had this argument about what kind of health care should we have. Everybody should be covered, in my opinion. Everybody should have the right to quality health care. We have hospitals in this city and in this borough that provide quality health care, and we also have places where there aren't hospitals. There are other healthcare facilities. We've gotten them a lot of money as well. So nothing good is coming out of this terrible virus. But if it makes us stop and pause and push the reset button and shows we can move forward and have a chance to build something from scratch, that's what we should do. New York has lost a lot of revenues, and again, we will have money in a bill that will make New York City, and other places whole. We also need to put more money to make people whole, so that rates of asthma, so the Bronx isn't the first in all these bad things. We know what the problem is. We're spending lots of money on lots of things. Healthcare should be one of them.
I do want to we still have hundreds of people joining us, but everybody who submitted questions via the Q&A function, If we didn't get to them specifically, everyone will be reviewed and then forwarded to the appropriate elected official, and their office can respond and follow up. I want to talk about, I guess, again, it's one of those that go. I'm thinking about who should get the question, so it'll go to everybody, because everybody, both the federal government, the state government, and the city will have a hand in this, and that is to what to do with gig workers. One of the things we've learned through this process, if we hadn't already realized, and I think the number was over 300,000 so-called gig workers, people who work in restaurants or other places where they don't have full-time jobs, they're paid by the hour, and they've been particularly hurt in this. So I guess it's both a short and long-term question. How do we deal with them now? Many of them, they're filing for unemployment. It's kind of a difficult situation. Then the long term is, what do we do with them in the long term? Can we structurally change the nature of their work, because it's vital work, it's vital for them and their families, but yet they're the first ones out and the first ones to suffer when something like this happens. So Congressman, we'll start with you on that. Gig workers and all those people who are not paid by full-time jobs.
Well, we have to start looking at retraining people. There are obviously some jobs that at one time were prevalent and now they're not. I think that this gives us an opportunity to review the whole structure and try to make people whole. It's not easy, and it's going to take a lot of money. But if we are spending the money, and it gets back to what I said when we were first talking, I want to make sure that the money is spent helping the gig workers, helping people who ask for nothing more than to be able to have a good job and security and not have to suffer from paycheck to paycheck. Parts of our society are going to be changed forever because of this calamity. We should take those bad parts, discard them, and move in with the money that we are allocating for all these other things. We should move in so we can help train people like the gig workers and other people as well. And that's why, again, we fought so hard to make sure that it wasn't Wall Street billionaires that were getting rich, that the bill had lots and lots of money for poor, for the working poor, for middle class, for people who just want a fair day's pay for a fair day's work. And when push comes to shove, that's something that, as the richest country in the world, we ought to be able to provide to our citizens.
And I guess also we can add the self-employed into that question, because that's another whole category of people.
Absolutely.
Who are hurt. Senator, let's start with you, Assemblyman, and then we'll go to the councilman.
Sure. So this was a conversation that we were having prior to the COVID-19 outbreak and the passage of the state budget about gig workers and certain classifications of those who had been considered to be independent contractors, and those who, for example, the taxi cab drivers. I met with a number of them, and many of them enjoy the frequency that they can work or not work. The lifestyle that they choose to lead or not lead when they're working. Right, we have to be careful about how we classify gig workers. When you look at how California did it and some of the missteps that were made over there with that classification. But also it comes down to the central point of what Congressman Engel said, is that regardless of how you're classified as a worker, we as government have to figure out a way to be able to help those who are in need in their time of need. So I think the classification question can be one for a later day that we can put off. I just wanted to make sure we mention it as something that is being discussed. But everybody should, regardless of what your status is, and status in many different ways, we as government need to be able to step up.
Okay, Assemblyman.
Well, the Pandemic Unemployment Assistance Program addresses the issue of independent contractors, of the self-employed, of gig workers. I mean, this has actually been an issue, as the senator said, before the virus. But so they are eligible, I believe, for unemployment. I think the process of applying through the state might be slightly more difficult for them than people applying for the traditional unemployment. But we live in a different world now than we did in the past. And all of these type of workers that I described have to be taken care of just like everybody else.
Okay, and Councilman, for you?
Uh, I would say that honestly that Jeff and Senator Bailey covered it mostly. I will say though that the City Council has really been at the vanguard of some of these issues. We've passed a number of workers' rights for freelancers, for gig workers prior to this. People don't know, but the City Council was at the vanguard of paid sick leave before I got there. We had already put paid sick leave for city workers. So we've really been at the forefront of this, and I'm confident that we're going to come up with creative solutions also as this develops.
Gentlemen, and to our viewers as well, we have about 5 minutes left in the program. So I thought we would just literally go around. We have 4 elected officials. I think they could fill the 5 minutes. And just ask, is there anything that we didn't talk? I mean, there are still many questions, and you're going to get referred many questions that people submitted. Is there anything else that we didn't talk about during this crisis that you want to have your constituents know before we sign off? So, Council Member, let's start with you.
Someone I saw submitted a question regarding the not-for-profit. I am very concerned in the city budget about services by not-for-profits, Mashu Lamont Community Center, Kingsbridge Heights Community Center, the Lambert House, our senior centers are all run by not-for-profits. And while I think the city budget is going to focus mostly on people's needs as opposed to their wants, it's important to me that we maintain our not-for-profit infrastructure through this. So really my focus between now and the end of June is going to be trying to come up with a city budget that meets people's needs, but protects the city infrastructure ultimately for a return to better times. So Gary, by the way, I wanted to say, the rest of us are we're doing our jobs and you're volunteering. So I want to say thank you for doing that. Thank you.
I really appreciate it. It really is public service. Look, if you can't do in this day and age right now, if you can't do what you can, then who the heck are you? Anyway, I appreciate that. Thank you. Assemblyman Dinowitz.
I just wanted to mention, because I don't think I did, we have some groups in our own district doing incredible work, food pantries, such as the Kingsbridge Heights Community Center, the Marshall Montefiore Community Center, St. Francis of Rome Food Pantry in Wakefield, and there are more, I'm sure, that are really doing incredible work, and people should be aware of that in case they want to support those organizations if they're so inclined. One last thing I want to say. I saw that masks are being distributed to everybody who lives in NYCHA, and I have 5 NYCHA buildings in my district, and I think that is really great. But I would hope that the most powerful country on the planet can find a way to make sure that everybody has access to masks and other equipment that they may need. And it's just amazing that up until now that hasn't happened. And with that, I just want to say thank you, Gary. Thank you, Congressman Engel, Senator Bailey, and Councilmember Cohen. I really appreciate working with you and everything that you're doing for our communities.
All right, thank you very much. Senator, for you.
So again, I'll start there. Thank you, Gary, Andy, Jeff, Ellie, for all that you do for our communities in such a trying time. Mine is just more introspective in nature. I think we've touched on a lot of the substance. I just want to encourage us to carry on the spirit of kindness that we've suddenly found. And I hope that we don't lose it. Continue to check on your neighbors, check on your loved ones, call and text people to see how they're doing. You may not think it means a lot, but those words can mean a lot to somebody else. Check on people, check on your family. And if you have the ability, if you're able to, volunteer for something. Help somebody out. Call a senior. We can help facilitate that conversation for you to call somebody who hasn't spoken to somebody in some while, in quite some time. I just ask that we continue to be good, and not only good, but great neighbors to those of us who need it the most, and that we can carry this on long past whenever it is that we resolve the situation. So to everybody that's tuned in, I thank you.
Thank you very much, Congressman. You get the last one. You have about 60 seconds to do it.
Okay, well, I'm going to then use my 60 seconds to thank you, Gary, for all the work you've done through the years. It's just been a pleasure working with you, and it's such an honor for me to serve with my colleagues here. You can see the caliber of great elected officials that they are. The Council Member Cohen and Assemblyman Dinowitz and Senator Bailey. It's great. We all work together. We're all a team, and you can see why it's such a pleasure to work with these gentlemen. I was born in the Bronx. I've lived in the Bronx all my life. I love the Bronx. You know, when we were kids in school, we learned that the Bronx was special because it was the only borough on the U.S. mainland, and I've never forgotten that. So we're unique. We do have our problems, but putting our heads together, there's nothing really that can stop us, and we're all committed to doing that. So thank you for the opportunity to appear, and thank you for the good work that you do for so many years for the Bronx.
Thank yous are all over. I think the Assemblyman and his office helped to put this together. So.